Good evening, everyone. This is Dr. Eldred Taylor, and this is our bi-monthly webcast brought to you by the American Functional Medicine Association. This is an association. It's in its initial year, and our goal is to give you information to help your functional medicine practice become functional. We don't want to just give you information for the sake of giving you information. We want you to have information that you can use in your practice that helps you as a clinician, helps the patient, and also helps your business. We invite all of you to attend our first annual Functional Medicine Conference that will be held at the Hyatt Regency in downtown Atlanta on March 6th through the 9th, 2014. As you can see, we have a great lineup of guest speakers, very experienced speakers, and they have been given the task to present information that is going to be helpful in your practice. We have charged all of them to make sure that they will give you information that you can use. And if you've been with us for the past weeks, we wanted to give you a taste of what you will hear when you come to Atlanta in March. And we expect all of you to be there. And we will talk about the special offers that we have to make it easier for you to get there in March. Again, we have a guest speaker here. We're very happy to have him. And some of you may have heard him or may know him because he's been on the speaker circuit for a long time. Most of these people that are coming in March are the people who have taught me a lot. The privilege that have had to speak at several conferences. I get the privilege to hear the other speakers, and this is a speaker that I have shared the podium with on several occasions, and is Dr. J. Mead. Dr. J.H. Mead is the president and medical director of Labrix Clinical Services Incorporated and a visionary for innovative testing for discerning practitioners. He is a leading expert in salivary hormone testing. Dr. Mead has been practicing as a clinician for over 20 years and understands the need and value of accurate, reliable laboratory testing. Dr. Mead is a board certified pathologist, a retired U.S. Air Force flight surgeon, and co founder of a progressive full service complementary and alternative medicine clinic. He also has board certification in blood banking and led the Pacific Northwest region of the American Red Cross as a chief medical officer for over 10 years. Dr. Mead is also the co author of a well received book, Slim, Sane, and Sexy Pocket Guide to Natural Bioidentical Hormone Balancing. Dr. Mead, are you there?
I am here,
Okay.
and I'm so grateful for this opportunity. I do appreciate this, Dr. Taylor.
We are happy that you were able to make it. And I think if you click on that button, there you go. All
Yeah,
right.
we should be on. All
Yes.
right. Well, let's give me a few minutes. I'll be brief and want to do a little overview of what Labrix does. But before
Okay.
that, I want to thank you for that generous introduction. And I dare say I've learned a lot more from you than you may have learned from me. And I appreciate all that you do.
Thank you very much. And so the stage is yours. I'm going to mute myself. Yeah, you have the floor.
Well, again,
Okay.
thank you, and
Mhm.
I'll be succinct, and and you can get on with the rest of your program shortly.
Okay. All right. Don't worry. All right. Thank you.
My pleasure, sir. Well, Dr. Taylor has pretty much given you an overview of my career thus far, and there's a mugshot of me. Uh, also want to introduce Dr. Erin Lohman. She will be at the conference as well, although not speaking, but she will definitely be there if you want to get a chance to meet one of uh, the other co-founder of Labrix Clinical Services. And she's also a co-author of the Slim, Sane, and Sexy book mentioned before. Labrix has a mission statement, and we're very proud of what we do. And we are an excellent laboratory. Our quality of testing is at the highest standards, state of the art, if you will. And our purpose as clinicians, and in particular mine as a pathologist, is to see that you get accurate results, succinct results quickly, and that they are applicable and helpful to your patient practice. And we focus on optimal hormone balancing. And we are a CLIA certified laboratory, and you have to be a CLIA certified laboratory to legally practice. So that's not a big deal, but the big deal for us was getting our New York certification, and we're very proud of that. They put you through the ringer there, and we did that with flying colors. And by the way, we're located in the Pacific Northwest, and we're proud of that. We love our trees up there. We hug them now and then. It's Dr. Norman and I prepared to start Labrix 9 years ago. There were a few things in the field of salivary testing that we wanted to modify and implement. And one was the remedying this particular problem. Sex hormones vary throughout the day, and here's an example of two women in luteal phase, and their estradiol levels are jumping all over the place. And in order to get an accurate result, we felt it was necessary to figure out some way to average these hormone levels throughout the day. And I came up with this idea, and I thought once a decade I have an idea that's somewhat useful, and this was mine from the last decade. And that was to take an equal aliquot from the 4 time tubes in the test kit. So in other words, if you're going to do the 4 cortisol levels, you're going to do 4 time tubes throughout the day. And what we do is we take an equal aliquot from each one of those tubes, and we make a pull tube, and from that pull tube, we measure the sex steroid levels, and we buffer out that fluctuation. And from a clinical standpoint, that has been very useful in our practitioners to validate that daily for us. Also, the sample size can be a problem, particularly for some individuals who have low production of saliva. So we, as we were moving forward, decided to use a very small volume collection system, which is actually a 2 ml tube. And it just takes 2 to 3 minutes to give us a sample. We find patient compliance is very high. And out of over 200,000 samples, we've only had one patient who was unable to give us an adequate volume. Another observation we made that's been an improvement in the field is that to actually understand and get from the medical literature when the peak cortisol level is throughout the day. 30 minutes after you awaken is the peak time, and that's when we recommend that in our test kit instructions. So we have a very simple test kit. It has 4 colored tubes that are timed throughout the day. Everything's linked to color, and only one set of instructions. So everybody gives us the 4 tubes, regardless if they're going to do a cortisol or not. And our turnaround time, we're very proud of. We guarantee a 5 business day turnaround time. Otherwise, the testing is gratis. And we only provide testing to providers. Private individuals cannot access a Labrix test through Labrix. Our turnaround time average is 2.27 business days for saliva, neurotransmitters 3 days, and our combo kits also 3 days. Now our staff is trained. They're clones of Dr. Lohman and myself, and they review all the reports that come out of Labrix. They look at the patient symptoms, they look at their supplementation history, they review the lab values, and they provide an individual interpretation on every single report that we issue. And we have a lot of experience, and I won't dwell on that any further. You saw the color of my hair, and my staff is also very experienced, and they are clinicians, and they love to take phone calls, and they're there on site to take phone calls and help with consultations on any reports, whether they're saliva or urine neurotransmitters. We also have live webinars. We have a library of webinars, newsletters, information sheets that we gladly provide to support our providers. And also we have materials that you can hand out to your patients. And here are some examples of those materials. And the applications of our testing are numerous. For those of you who've been in the practice for a while, you know how beneficial hormone testing and now with neurotransmitters entering the market, how important they can be to figuring out some of these more complicated cases. Our pricing we're proud of, and I'll skip over this quickly. You can come visit us while we're in Atlanta if you'd like to. Now, the most important and compliment, and most helpful compliment, of course, any business can have is to have customer support like this. And over half of our business and new accounts come from referrals from our providers. Now to this wonderful conference that's coming up, the American Functional Medicine Association of Atlanta. We're delighted to be invited to that and be part of that. This is the title of my presentation, Why Identicals, Brain Chemistry, and Baby Boomers, Advances in Hormone, Adrenal, Neurotransmitter Solutions for Menopause, Perimenopause, Andropause, Metabolic Syndrome, and more. And just as a teaser, we're going to be in business for a long time. That's good to know. Knowing that there are 10,000 boomers turning 60 each day, and these folks tend to have money, and they're very unhappy with the common medical model. So they're looking for the alternative, and we're here to help you provide that as we provide it in our clinical practice. And this trend will at least last another 17 years. I suspect once this catches on, it's going to be a paradigm shift in medicine. And during my presentation, we're going to try to integrate these systems for you. So I urge you to attend that presentation, and I'll look forward to seeing everybody there. But we're going to look at the neurotransmitters on the one hand. We're going to look at serotonin, GABA, norepinephrine, serotonin, dopamine. And then we're going to look at the adrenal functions. We're going to look at the androgens and the estrogens and see how we can integrate these systems together, because they certainly are integrated in our body. So I really look forward to seeing everybody in Atlanta, and please stop by and say hi when you get there. We'd appreciate it. And with that,
Okay.
I'm finished, Elvie.
Okay, Dr. Mead. Now, you've been doing neurotransmitter testing for how long?
We started neurotransmitter testing officially a year ago. It took us, we've been doing it a year to evaluate it and validate it prior to that. And we use mass spectroscopy to
Okay.
measure the neurotransmitter levels. And that is, there's nothing more accurate than actually looking at the structure of the molecules that you measure. And that's what we do for neurotransmitters. And that took a while to set up. Those are, I don't want to tell you the price of that machine.
Yeah.
It set us back a little bit. We're
Yeah.
glad to have it and be doing it.
Well, I always say that neurotransmitters affect hormones and hormones affect neurotransmitters. So it's great that
Certainly.
you have kind of, I'm looking forward to it. I just knew about it on a cursory in a cursory type way that I know and that's why they use antidepressants to help with hot flashes. It's
Yes.
definitely
Mm-hmm.
a
Mm-hmm.
correlation there. So I'm glad that I'm looking forward to this and understanding how to kind of use that information and manipulate and be able to use both of those in concert to see if we can get even better results with and to help these perimenopausal women feel a little bit more normal, because you see along with the hot flashes, most of these patients will start complaining they have poor concentration, poor memory.
Mm-hmm.
It's all a part of menopause over and above. Sometimes that's more disconcerting than the hot flashes.
Yes. And this gives us another tool to assess
Right.
that.
Right.
And the treatment for it, it doesn't have to be a SSRI
Oh,
like
yes.
Prozac and Zoloft and so forth. Amino acids that are readily available, just altering one's amino acid nutrition levels can
Y-
make a huge difference. So
Yeah.
we're really pleased to be able to offer this, and I think hopefully we'll keep a lot of folks off of those antidepressants, which are so commonly used. Okay,
Yeah.
we'll talk about how commonly they're used in a hearing.
Yeah. Well, you're speaking my language. I'm a big proponent of amino acids. Also, along with people on proton pump inhibitors that decrease
Oh,
stomach acid, and you have to have
uh-huh.
stomach acid to break down protein into amino acids. So I have really been pushing amino acids. We do heart rate variability that can show low amino acids, and I would tell you almost everybody over 30 probably has
Mm,
amino acid deficiencies. And
mm,
yeah, and, we were at a seminar to we were at a I was giving a seminar, and one of the doctors there was a psychiatrist, and I was showing him about how SSRIs only make low serotonin levels last longer by preventing the reuptake. But really, when it's out in the synapse longer, monoamine oxidase breaks down the serotonin quicker, so your serotonin level keeps going down lower and lower. And so I was
yes.
showing him the diagram,
Mm,
and I was
right.
explaining all of this, and it was so hard for him to admit that that is what SSRIs do. And that the
Mm,
simple way would be just to make more serotonin by giving the person tryptophan or 5-HTP. Finally, by the
right.
end of the day, he actually admitted that that was a viable alternative. And I think by the end of the 2 days, I had him convinced. I had him. What I was trying to get him to do was to think it through on his own and just not do what all the other psychiatrists were doing. So
Mm,
after about 2 days, I think
mm.
we finally got that message across. But anyway, I think this is great. I think you're the only salivary lab, and everybody here knows that I'm a big proponent of salivary testing. You're the only salivary lab that are doing both neurotransmitters and hormones and trying to make that connection very clearly. So I
Well,
commend you on that.
we're proud to be doing this. I tell you.
Yeah. Well, I commend you on it, and anybody who's listening and anybody who's going to listen to the recording, this is something you should really hear. And I think that Dr. Mead, one, he's a pathologist, and two, he's had a long history of salivary testing, and he's putting this information together in a way that is easily digestible and easy for you to take home and use it. So, right before you leave, let me see if there's anyone who has a question. Uh,
Okay.
Marcus Carruthers, let's see. If you can raise your hand, there's a little uh, icon there for raising your hand. Just see, I don't want anybody to be shy. Pete, let me see if anybody is. We are planning to attend. Okay. Okay, Dr. Mead, no one is raising their hand. I think they're what we want them to do anyway. If they have questions, to come to Atlanta and ask you there. So that's
Very
what we're
good.
hoping. Okay, so we'll let you get back. What time is it? 6:30 there. So you're just ending your workday. So we'll let you
Oh,
wrap up and get home. Oh,
well,
it's
thank
actually
you. Appreciate it.
5:30. It's
Again,
5:30 there.
yeah, it's only 5:30, but and
Yeah.
I do appreciate again this opportunity, and I look forward to seeing everybody.
Okay, and good to talk with you, Dr. Mead, as always.
Yeah. Thanks, Dr.
Okay.
Taylor.
All right. Thank you. All right. Bye bye.
Bye.